I was studying at USM for a graduate degree in mental health counseling and social work. And I would just hear in that program, there was this, we would talk about the history of mental health services in the state of Maine and how we moved away in the 80s from, this model of institutionalization for people experiencing mental health and substance use, where we would just, put people in AMHI, the Augusta Mental Health Institution, sort of lock them up and throw away the key and let them languish for decades, years or decades sometimes on end. And we just, rightly discovered that was a really inhumane and ineffective way of dealing with mental health. So the idea was we're supposed to take money out of institutions and put it into community integration services, of which there are a number of great providers in the state of Maine. They're just underfunded, where you have supported housing and supported employment and supported X, Y, and Z, and you help people integrate into the community. And that's not what happened. We took that money and I don't know where it went. It went into tax breaks for billionaires. It went into more money for policing. And I think, it's sort of, if we're not investing in, we have to think about public safety as a whole spectrum. So it's housing, it's mental health, it's education, it's all these things that factor into public safety. So if we're thinking about public safety, we have to be investing in those things and not just in, the treating the symptoms. And when people start acting out of desperation, they have nowhere else to turn. That ends up becoming a criminal offense, unfortunately.